Hey guys, welcome to another Tech Tip Tuesday. My name is Jason Lippman. I'm one of the sports medicine doctors for USA Ski Mountaineering, and we wanted to spice things up a little bit this week and talk about a medical topic for ski mountaineering. And what we're going to focus on first is foot care, which I think we can probably all agree is a pretty pivotal point in terms of how easily we make it through a week or a training block or a race, right? Ski mountaineering is kind of tricky in that it's an endurance sport with a lot of foot and ankle activity and output, but that we're in these hard, rigid ski boots during the course of the race and during the course of training. So prevention is key, and it needs a little bit of a twist with what we do, because unlike with trail running in the upcoming seasons where we can take our shoe off pretty easily and deal with a hot spot before it becomes a blister, it's difficult to do that, right? And sometimes not really safe to try to do that when we're out in the backcountry or during a race. So what I tend to recommend is that if you can, beginning of the season or at the beginning of a new pair of boots, try some short training sessions. Try to figure out if there are spots that are becoming easy hot spots in the heels or the side of the toes or between the toes. And then those are places you want to try to start addressing proactively in terms of taping or Vaseline. I have always used just a little bit of Body Glide or even some Vaseline between my toes, which are spots that, especially with trail running, were an issue at times. But if I know there's a spot, say on my heel, where I get blisters from my boots, I keep kinesiology tape around a lot. And there's a lot of brands out there. I don't need you to choose one, but I think the awesome part about this type of tape is just that it's so flexible and it has a really solid adherence side on the back. So you can cut this into the right size strip and it really easily will form around weird spots like the back of your heel, which tends to be a decent hot spot, but also somewhere that things are liable to kind of roll off of. So some folks, if they know they have a hot spot back there, will use a tape adherent kind of on the skin against the interface where the kinesiology tape is going to go. And then you just add this right over top of that. And that way the liner kind of shears off the tape rather than rubbing against the skin. Other folks do things like Engo patches, ENGO, which are meant to reduce friction. You place those on the liner actually and stays on the liner and decreases the risk of having blisters from that. But I keep this stuff kind of in all of my packs in case something pops up, and it's just kind of scattered around my kit. Now, if you develop a blister, it's going to be tricky to deal with it out on the mountain, right? So what are we going to do after we get one, if it pops, or between the next training day? Well, what I would say is when you get back to the car, the first thing you want to do is make sure you go ahead and clean the area off, because once the blister pops, it's now not a solid protectant against bacteria getting under the skin. Which leads me to my second point, which is going to be that if you develop a blood blister, which is one of those blisters that obviously looks like it's red or dark or cloudy inside, I want you to avoid popping it at all costs. And if it does pop, take very good care to clean it, because that shows that there's a blood vessel that's actually communicating with the patch and could lead to easier access for bacteria into the rest of your system, which increases the risk for infection. So if you have a blister that pops up and it isn't popped yet, one thing you can definitely do going forward or just the rest of the day is use moleskin, which is kind of old school but does work. Basically what you can do is cut a little circle out of it and then a second little circle in the middle, end up with a donut you're going to put around the blister, so it's fully kind of encompassed inside. And you get the right thickness just so this ends up being about as tall as the dome of the blister. And then it takes the pressure off directly to the blister and reduces risk of it shearing and popping. Beyond that, one thing you can do is use something like second skin, which is a gel kind of layer that goes over top of the blister, protects it, and also absorbs some of the fluid that leaks out sometimes. If it pops, like I said, you want to go ahead and clean it out, or at least clean it off. I keep a little med kit in my trail running bag for sure, or in my touring bag, but I'm a doctor, so that's kind of my thing. First aid cream, either a little bit of bacitracin, which has an antimicrobial component, or something similar, really just for that first application to clean things off. And then you can use Vaseline over top of it going forward. And that is to keep the risk of infection down from there. The last thing, and this is kind of, you have to take it where you need it is if things look clean and you're going forward, but you need to get back out to training the next day, we'll use the things we talked about in terms of covering it and padding it. But you can use a little bit of zinc oxide, which is actually what they use for diaper rash, and place it over the roof of the blister. I wouldn't necessarily do this if you have a deep one that's unroofed because it can be uncomfortable and risk getting it a little bit dirtier, but this hardens the roof of the blister up a little bit overnight and will give you a little bit more durability after taping and padding to get back in your boots for the next day. Okay guys, so that's all we have time for this week. I'm excited about bringing you guys more medical content going forward. And we'll see you guys next week for our next Tech Tip Tuesday. All right, see ya.